Imagine a disease so relentless that, despite decades of research, it remains one of the deadliest forms of cancer known to humanity. In the United States alone, pancreatic cancer claims thousands of lives each year, with a survival rate that is shockingly low, just about 10%. But what if there was a glimmer of hope, a series of breakthroughs that could redefine what it means to live with this formidable adversary? Today, we're diving into the world of modern medicine to explore the latest advances in pancreatic cancer treatment that are not just fighting back, but are changing the game. Pancreatic cancer is notoriously aggressive, often diagnosed in later stages when treatment options are limited. This has made the quest for effective therapies all the more urgent. But thanks to cutting-edge research and the unwavering spirit of the medical community, new treatments are emerging that target cancer more precisely than ever before. These innovations aren't just clinical trials and statistics, they represent real hope for patients and their families. From revolutionary drugs that target specific mutations to advanced surgical techniques that offer life-extending options, each advancement brings us one step closer to turning the tide against this brutal disease. Join us as we explore these 5 new treatments that are giving patients a fighting chance at a longer, healthier life. This isn't just information, it's a beacon of hope for millions. And it's something we believe everyone should know about, share, and discuss. Number 1, targeted therapy. As we dive into the forefront of pancreatic cancer treatment, one of the most promising approaches is targeted therapy. Unlike conventional treatments, targeted therapy does not take a one-size-fits-all approach. Instead, it uses drugs or other substances specifically designed to attack cancer cells without harming normal cells. These therapies target the specific genes, proteins, or tissue environment that contribute to cancer growth and survival. This focus not only potentially increases the effectiveness of the treatment, but also minimizes harm to healthy cells, reducing side effects and improving quality of life for patients. Take, for example, erlotinib. This drug targets the epidermal growth factor receptor, EGFR, which is overexpressed in some pancreatic cancer cells. By inhibiting this receptor, erlotinib can block the pathways that promote tumor growth. While targeted therapy offers a beacon of hope, it's not without its challenges. The effectiveness of these drugs can be limited to patients whose tumors have specific genetic mutations, which requires genetic testing and may not apply to all. Moreover, like all cancer therapies, resistance to treatment can eventually develop, and the cost of these targeted drugs can be high, posing accessibility issues for many. Despite these hurdles, the advantages of targeted therapies often outweigh the disadvantages. They represent a more personalized approach to cancer treatment, pioneering a path toward more successful and sustainable outcomes. Ongoing research and clinical trials continue to push the boundaries, aiming to make these innovative treatments more effective and accessible to those in need. Number 2, immunotherapy advances. Next in our exploration of cutting-edge treatments for pancreatic cancer is immunotherapy. This revolutionary approach harnesses the power of the body's own immune system to fight cancer. Immunotherapy treatments help the immune system recognize and destroy cancer cells, an approach that has transformed the outlook for many cancer types. In the realm of pancreatic cancer, immunotherapy has shown promising strides, particularly with checkpoint inhibitors. These drugs help unleash the immune system by blocking proteins that prevent immune cells from attacking cancer cells. Trials with drugs like pembrolizumab have opened new doors for treatment, particularly for patients with specific genetic biomarkers. The advantages of immunotherapy are significant. It can offer a more targeted approach with potentially fewer side effects compared to traditional chemotherapy and radiation. And in some cases, it can lead to long-term remission. However, immunotherapy is not without its challenges. Not all patients respond to these treatments, and the reasons why are still under study. Side effects can also vary widely, from mild to severe, depending on how the immune system reacts, which sometimes can be unpredictable. Additionally, the cost of these therapies can be substantial, making accessibility a concern. Despite these obstacles, advances in immunotherapy offer profound potential. Ongoing research is continuously improving how these treatments are used and increasing the number of patients who can benefit from them. For pancreatic cancer, a disease notoriously difficult to treat, immunotherapy represents a critical component of the evolving treatment landscape. Number 3, minimally invasive surgical techniques. Turning now to surgical advancements in the fight against pancreatic cancer, minimally invasive techniques have revolutionized how surgeries are performed. Among these, robotic and laparoscopic surgeries stand out for their precision and minimal physical intrusion. Robotic surgery, for instance, involves the use of robotic arms that the surgeon controls from a console. This technology provides a magnified 3D view of the surgical site, allowing for extremely precise movements. Similarly, laparoscopic surgery involves small incisions and the use of a camera and surgical instruments to remove tumors, often resulting in less overall trauma to the body. The benefits of these techniques are significant. Patients often experience reduced recovery times and less post-operative pain. This not only shortens hospital stays, but also reduces the risk of complications and speeds up the return to normal activities. However, these advanced techniques are not without their disadvantages. The high cost of robotic systems can make these surgeries less accessible in some regions. Moreover, they require surgeons to undergo extensive training to develop the necessary skills to effectively use the technology. Despite these challenges, the shift towards minimally invasive surgery in pancreatic cancer treatment is a clear step forward. It reduces the physical burden of surgery on patients, improves surgical outcomes, and represents a significant advancement in medical technology. As more surgeons become proficient and technology becomes more widespread, these methods are set to become more accessible, offering hope to a greater number of patients. Number 4, new radiation therapy techniques. Radiation therapy has long been a cornerstone in cancer treatment. However, with the advent of advanced techniques like stereotactic body radiation therapy, or SBRT, the precision and effectiveness of radiation treatment have reached new heights. SBRT involves delivering high doses of radiation to a tumor from various angles in a few short sessions. This technique allows for extremely precise targeting, which is particularly advantageous for pancreatic cancer, as the pancreas is nestled among critical structures that can be easily damaged by traditional radiation. The benefits of these new radiation techniques are profound. By focusing radiation more precisely, SBRT minimizes damage to surrounding healthy tissues and organs. This not only enhances the effectiveness of the treatment, but also reduces side effects, making the therapy more tolerable for patients. Additionally, the shortened treatment duration means less disruption to patients' lives. However, SBRT is not without challenges. The high precision requires extremely accurate tumor imaging and positioning, which can be difficult given the pancreas's mobility within the abdomen due to normal breathing. This necessitates the use of sophisticated imaging technologies and sometimes respiratory gating techniques, which can complicate the treatment process and increase costs. Despite these obstacles, the advancements in radiation therapy techniques like SBRT are a significant leap forward in treating pancreatic cancer. They offer patients a more targeted, efficient, and less invasive treatment option, continuing to push the boundaries of what is possible in cancer care. Number 4. Personalized medicine and genomics. The final frontier in our journey through the latest advances in pancreatic cancer treatment is personalized medicine and genomics, a field that is rapidly transforming the landscape of cancer care. Personalized medicine and cancer treatment involves analyzing the genetic makeup of a patient's tumor to identify unique biomarkers. This genetic profiling enables oncologists to tailor treatment specifically to the genetic alterations present in the cancer cells, potentially increasing the effectiveness of the treatment while minimizing unwanted side effects. Recent successes in this area are promising. For example, the use of targeted therapies like PARP inhibitors for patients with specific genetic mutations related to DNA repair mechanisms has shown significant effectiveness. Ongoing research is continually uncovering new targets and refining therapies to exploit them. The advantage of this approach is its precision. By targeting therapies to an individual's specific cancer profile, personalized medicine can lead to better outcomes, fewer side effects, and a more efficient use of healthcare resources. However, there are also challenges to consider. The complexity and variety of genetic mutations can make it difficult to find effective treatments for every patient. Additionally, the cost of genetic testing and developing customized therapies can be high, potentially limiting access to personalized treatment options. Furthermore, the rapid pace of research means that regulatory bodies sometimes struggle to keep up, posing challenges for approval and integration into standard care practices. Despite these challenges, the field of personalized medicine and genomics holds incredible promise. It represents a shift towards more patient-centered cancer care, where treatments are not only about extending life but also improving the quality of life for those diagnosed with pancreatic cancer. Today, we've journeyed through the most groundbreaking advancements in the treatment of pancreatic cancer, from the precision of targeted therapies and the power of immunotherapy, to the finesse of minimally invasive surgeries and the sharp focus of advanced radiation techniques, all the way to the personalized approach of genomics. Each of these developments brings us closer to a future where pancreatic cancer is no longer a verdict but a manageable condition. The road ahead is paved with promise, and the relentless spirit of medical innovation continues to light our way. To stay updated on these and other breakthroughs, subscribe to our channel and follow us. Together, we can keep hope alive and stay informed. Join us in the fight against pancreatic cancer by sharing this video and spreading the word.